Hi, I'm Michelle McGregor, and I'm a physical therapist here at Five Stones Integrative Health. I'm here to talk to you today about pelvic floor dysfunction and its impact on the musculoskeletal system. Signs of a pelvic floor dysfunction can include pain, pelvic pain during sex, difficulty with urination and bowel movements, incontinence during urination and bowel movements, and/or a bulge or prolapse at the opening of the vagina. Many patients with low back pain have an accompanying pelvic floor dysfunction. This is something that many pelvic floor therapists have known for years due to the intimate connection between the lumbar spine and the pelvis itself. However, a lot of lay people may not realize or even recognize that the two can be related. The pelvic floor is comprised of an entire group of not only muscles but ligaments that extend from the pubic bone in the front all the way to the tailbone in the back and across both sides. If there's a dysfunction in these areas, you're unable to stabilize the lumbar spine during movement in a way that you should, and this can result in instability and pain. We often talk about the core in regards to lumbar spine health, but not everyone realizes that the core actually incorporates the pelvic floor muscles as well as the abdominal wall. Given that 70 to 80% of our population will experience at minimum one episode of low back pain in their lifetime, this is an area that is worth consideration. One of my favorite quotes by Ida Rolf, who is a functional medicine therapist, is actually, "Where you think it is, it ain't." And I love this quote because it reminds me that when a patient walks into the clinic, I'm not simply looking at the area that they are most concerned about, which often I do see a lot of low back patients. But you want to look at the entire body system, and that includes looking at different movement patterns of the whole body, not just the body part in question, and then really interviewing the patient to find out their medical history to see if there may be another body system that is involved. And this is where the patients being great historians is really, really helpful. Sometimes patients will tell me, "Oh, I'm sorry, I'm telling you too much." But no, I want you to tell me all of that information. All of that background information is very, very helpful in creating not only a treatment plan for you, but in understanding what's going on in your life and how that may be impacting your total recovery. When I do an evaluation, if I do find that there may be something more going on that is specific to a pelvic floor dysfunction, that's where I'm going to send you to someone that is more specialized than myself, who actually will only treat that diagnosis. It's really important that you get that referral right away if you're coming in to see me for low back pain and you do have that dysfunction. There are a few therapists in the area that I highly recommend. And it would be important to get a collaborative treatment approach for you in order for you to succeed and get better. So don't lose hope. There are lots and lots of practitioners out there who do specialize in this area, and if nothing else, you can get some research materials and do some of the treatment methods on your own. One basic pelvic floor isolation technique that I like to recommend to my patients in order to find your pelvic floor muscles is to actually, when you are sitting on the toilet and urinating, in order to isolate these muscles, one of the things you can do is to try to stop the flow of urine midstream. If you can do that, you are isolating your pelvic floor muscles. You are using the right muscle group. That's something that I would recommend to anyone who is maybe having trouble isolating and finding those muscles. I would mention though that it is not something that I would do every single time that you go to use the bathroom. There is such a thing as doing it too frequently, and if you are isolating those muscles each and every time that you urinate, you could create a problem in terms of backflow with the bladder, and we don't want that. So isolate it, find it, don't do it every time. Moderation is the key. Once you're able to isolate the muscles of the pelvic floor, you can do so while you're sitting comfortably. You can do that sitting reading a book. You could do that while you're driving in the car, incorporating it into your daily lifestyle so that it becomes easier for you to not only complete, but becomes something that isn't what you have to do, not something that takes away from your enjoyment of other activities. Though you may enjoy doing the pelvic floor isolation techniques, who knows? Once you're able to isolate those muscles, it's important to avoid contracting the abdominal wall and the buttocks at the same time. That's a common practice, is for people to link in all three at the same time. But I really want you to be able to isolate the muscles themselves in that pelvic floor. And then later, if you want to incorporate that with an abdominal wall contraction and a buttocks contraction, that's fine. You also want to try not to hold your breath while you're performing these exercises. That's really, really common and very, very normal to do. So if you catch yourself doing it, just try to make sure that you are taking some deep cleansing breaths at the same time. I know this is a lot of coordinated effort, but just don't lose heart, because just like with anything else in life, the more that you practice, the better that you get. You're not going to get it the first time. So if you keep practicing it, you'll get there. You'll eventually get there. And as you get stronger in isolating those muscles, you can hold each contraction a little bit longer. Once you get to that point where you're doing maybe 15 reps a couple of times a day, holding each one for a few seconds at a time, you'll start to get stronger and stronger. And this is something that will take months to see a difference in your pelvic floor dysfunction. If you are doing this for a week and you say, Michelle, I'm not really feeling any better, I'm still having the same symptoms, that's because you haven't done it long enough. So just stick with it, stay the course. It will help. And one of the added benefits is that if you are continuing with these isolation techniques, not only will your pelvic floor dysfunction improve, but it can also increase sensitivity to the vagina itself, which can also stimulate not only better sex, but stronger orgasms, which is a win-win. So with that in mind, please reach out if you have any questions. I'm happy to answer, and if I cannot answer, I will direct you to someone who can. Happy Monday.